Hi, I'm Dr. Gary Sachs, and I'm here with Theresa Schmidt, nutritional therapist. And we've decided to come together to talk about some of the very common things, questions we're getting from our patients. And today we're going to talk about something very timely. All the stress and anxiety that we're all feeling with the many things that are happening in our personal lives, as well as in the world around us. So with that, we're going to talk a little bit about that.
Okay.
So, what are you hearing, and what is the stress that people are feeling so much these days?
So I'm hearing a lot about stress, and it's, just Monday, I think, or Sunday, the governor talked about closing down again,
Yeah.
and the high schools are closing, the colleges are closing, the holidays are coming. People are worried about whether they should go home to their families
Yep.
for the holidays. Should they travel? There's a lot of stress, and it just got ramped up.
Mm-hmm.
So it is a big issue right now. And so what I think we should address is the repercussions of that kind of stress, because it's been going on for a while. It got a little better, not totally gone, but now it's ramped up again.
Yeah.
And so long-term repercussions of stress are what I think we should probably address.
Yep. So many times people think their only alternative is to take a medication.
Mm-hmm.
And many people don't want to do that. They don't want to start down that path.
Mm-hmm.
And so I think what we want to do is say, no, there are some of the things you can be doing that are very helpful.
Yeah, for sure. One of the big things I tell people to do that have anxiety is they really should exercise.
Mm-hmm.
They should do some cardio exercise and burn that adrenaline out of their bloodstream.
Yep.
Because when we are anxious like that, we are in what's called fight or flight. So I hope most people know what fight or flight is or have heard of that.
Yeah.
But the repercussions of fight or flight. So, and this is also timely. Think of a deer running,
Mm-hmm.
because the hunter's behind him. So the deer hears the hunter and it spins and it runs. What doesn't the deer do? It doesn't stop to eat. It doesn't stop to go to the bathroom. It doesn't stop to sleep. It doesn't stop to do anything. It is running. That's
Survival.
all
It's survival.
Exactly. And it won't stop until it feels safe.
Mm-hmm.
So we are like that deer, and everybody's to their own degree of that, but that's what we're doing, which means we're not doing all the things the deer isn't doing. We're not eating properly. We're not sleeping properly. We're not taking good care of ourselves. And when we're in fight or flight, even our immune system is suppressed.
Mm-hmm.
It's a big one.
Yeah.
It's really important to understand that you can be doing all this good stuff for yourself. You can take all your supplements, but if you're in that fight or flight, it's harder to get that stuff to work.
Sure.
So we have to do the good things. We have to drink our water. We have to go to bed on time. No staying up till 2 o'clock to watch things every night.
Yeah.
We shouldn't be drinking a ton of coffee to keep bringing our adrenals up.
Yeah.
Try not to self-medicate too much with alcohol. That kind of thing.
Yeah.
It's really important that we realize that our body is suppressing our digestion, our ability to focus and concentrate, because it's all about survival right now. So those are the things we need to just be conscious of.
Yeah. So, and we know there are certain supplements, particularly herbal combinations, that would help people symptomatically, help with. But also there are things that can be done to sort of help us balance that fight or flight, balancing the other side of the nervous system, so that we're not so much swayed over to just feeling like we're in survival.
Yeah, it is like a teeter-totter. The sympathetic is our fight or flight, and the parasympathetic is our rest, digest, and heal. So those two things, they're not completely mutually exclusive, but they do teeter-totter with each other. So if this one's way up here, it means this one's way down.
Yeah.
So supporting everybody in the way they need to be supported is what we do. Because not everybody's the same.
Sure.
Everybody has different influences, different diet, different sleep habits, different jobs,
Yep.
different stresses in their
Their
life.
stresses affect them in a different way, a
Yeah.
different part of their body or something.
Yeah, absolutely. And
Yeah.
their history.
Yeah.
Their history of stress too affects them. So the beauty of what we do is we can really get it down to specifically what that person needs.
Mm-hmm.
Is the beauty of this. It is some supplementation. It is working on their diet. It is working on their lifestyle. It all has to go together.
Sure. And at the same time, even some of the parasympathetic things people can learn. What are the relaxation things that we should do? What are the things that help us tap into joy and happiness and feeling of well-being?
For sure. And confidence and security, all that stuff that we've kind of lost right now.
Yeah.
Yeah. Yeah.
That's great.
Good.
So we appreciate you tuning into us, and we hope that this time that we spend is helpful and healthful for you. Here at Sachs Wellness Center, this is what we do. This is how we specialize in helping people in natural ways. And as Theresa was saying, being able to really be specific about not only what might be helpful to your body, but how much. What is the amount that your body needs? So over and over again, science is proving the importance of the right nutrition at the right time to make your body function the best way that it can. So thanks a lot for tuning in.